Hi, my name is Dr. Laura Anderson, and I'm a licensed child and family psychologist. I've been practicing for about 20 years now. I have a business called Common Cord Psychology Services, and it's assessment and therapy and consultation. And Common Cord derived from sort of a place where two circles meet, where they intersect. And it's not an accident that I spend a lot of time talking to families about building on their strengths and bridging differences and figuring tough stuff out to help life go more smoothly. One of my areas of really specialized interest and expertise is adoption. As an adoptive parent myself, I sort of took that real life living room knowledge and blended it in with what I knew in theory after decades of practice. And it brings me to a place of really recognizing that although you cannot script, you can't say for sure an adopted kid will be like this and all adoptive kids have trouble with that, that's dangerous. There's no such thing. You can't make bullet point statements and you can't make prescriptions of exactly what challenges will be. And I know that our adopted kids are overrepresented in places where there's learning difficulties or they often have emotional regulation challenges. And a lot of that may have to do with what we know or we're starting to learn more about cortisol in utero and the separation from a primary caregiver. So stress during a pregnancy and then separation from pivotal birth families, regardless of the conditions, regardless of the situations. Makes sense that our little guys and girls' nervous systems are really wired to go to fight or flight sooner than other kids. And one of the biggest tenets that I've found helpful in my parenting and my work with families is soothe first, teach later. So soothe first and teach later. You can't teach a kid. You cannot teach them to do something differently if they're in fight or flight. You can't. They're in their lizard brain, in line with the whole brain child work and some of Karen Purvis's work. If you're trying to consequence a kid who's agitated at the height of their agitation, it doesn't work. You're just giving them consequences. I was giving mine consequences in my own agitation. It doesn't help, and they can't track it. And so I really work with adoptive parents to think about having soothers, lists of soothers, and ways of thinking about why your child's dysregulated rather than acting out. And to be thinking about what will soothe my child. How can I get them back into their thinking brain, their reasoning brain, their calming, soothing brain, and get them out of their emotional impulse brain. We know when you engage the thinking part of the brain, then the rest quiets, but they need to feel safe. And they need to trust that they'll be seen and soothed. And I work with adoptive parents a lot about coming up with a list of soothers for your kids so that once they're reorganized and regulated, we have a far better chance of reasoning with them and staying connected to them to help them learn what could have gone differently, how they could have handled a transition differently, how they could have handled conflict with their brother differently, how they could have handled disappointment differently, but from a teaching standpoint. So it's soothe first and teach later. Oftentimes we go to that place of consequence, like how am I going to teach them a lesson so they know not to fill in the blank? And it makes perfect sense why that's our go-to as parents. It is our job to teach, and we want to teach, and we want everybody to be safe and secure and respectful of others. And adoptive parenting really, I found in my experience as a parent and a professional, pulls on us to really sit with the challenge of getting our kids re-regulated, de-escalated, and then using our connection and our safety and our soothing to bring them through reasoning, to help build the skills, work out those muscles, the brain muscles, build bridges in the frontal lobe of their brain, and through our love and hugs and correction and soothing, rather than looking for a magic consequence that's going to be such a deterrent, they'll know they can't get away with that. Totally instinctive parenting. I get it. I did it. I've done it. And I've made big changes in how I parent at home, and I see the difference. And I bring that to my work professionally. So this is just part of a series of me putting the word out there on the work I do, hoping to be an invitation to adoptive parents who are looking for an adoption-informed assessor and therapist to work with them and to bring out the best in their family and to make sure that the best parts of our kids are shining in the community as well. I can be reached at drlsanderson@gmail.com and www.drlsanderson.com. Look forward to hearing from you.